Ladies and gentlemen, thank you for the kind invitation from the Egyptian Hypertension Society. It's a great honor to attend this World Hypertension League and the Egyptian Hypertension Society joint session topic on scale up hypertension control globally. I'm going to focus on the call to actions for hypertension control announced by World Hypertension League and partners. We all know that hypertension is a major risk factor for the mortality globally, no matter poor or rich countries. They are all the major risk factors for the disability and mortality. From global burden of disease research, we can see that for men and women, hypertension, elevated systolic blood pressure is the number one cause for women and the number two cause for men for the globally, for the general total number of deaths. And totally for men and women altogether, elevated systolic blood pressure attribute for more than 11 million deaths in 2019 globally. This number is 10 times more than the COVID-19 caused deaths last year. And also not only caused the mortality, but also caused the healthy life year lost. We can say the number two cause of disability adjusted life years for women is systolic blood pressure, elevated systolic blood pressure, and the number three cause for men. So both men and women altogether, the elevated systolic blood pressure attribute to more than 99% of disability adjusted life years in only 1 year, 2019. So the hypertension or elevated blood pressure causes the greatly number of deaths and also healthy life year lost. And we can understand if we can reduce the blood pressure and make it lower, then we can reduce the number of deaths and the disability globally, how much we get from that. So the evidence from prospective cohort studies or randomized control trials, they all demonstrated that elevated blood pressure log linearly related to the mortality from coronary heart disease or from stroke for all age groups. So if we can reduce the blood pressure, we could definitely significantly reduce the risk of cardiovascular mortality. The estimated number, if we can reduce the systolic blood pressure by 20 millimeter mercury for the 30 years and older the population, then we can halve the whole mortality risk of cardiovascular mortality by half. So reduce the high blood pressure can significantly, or the number one factors to reduce the overall mortality and specific of cardiovascular mortality. The evidence indicated we can do it, and we have plenty of strategy to do it, but globally we didn't do it properly. So the blood pressure control is inefficient globally. We can say totally we have 1.4 billion of hypertension patients globally, and only about half know they have the condition, and less than 40% get antihypertensive treatment, and sadly, only less than 14% of the patients get their blood pressure under control. So which means 1 in 7, every 7 hypertensive patient, only 1 gets their blood pressure under control. So this situation largely influences the mortality. We can and we should reduce mortality more if we can control hypertension firstly. That's the reason the World Hypertension League prepared this call to action for prevention and control of high blood pressure globally, and we launched it in Sao Paulo in 2019 with all our partners and also our member organizations globally. We hoped and we will work together to reduce the burden of hypertension and reduce the mortality and disability caused by hypertension. So within this call, we basically call our healthcare professionals and partner organizations to undertake actions to advance management, control, and prevention of high blood pressure globally. We need to work more efficiently and quickly. So first thing, we need to follow the best practice. For example, the HAS technical package developed by WHO and the partner organizations to improve the ability of primary healthcare services globally to improve hypertension control, diabetes, and other risk factors to control and prevention cardiovascular disease in primary healthcare. Secondly, we need to engage primary healthcare. They are the central for hypertension control and also for largely for cardiovascular disease and NCD control. To make sure the primary healthcare providers, they are the central. So in all our hypertension strategies, to make sure primary healthcare providers, they are the key players for hypertension control and NCD management. And thirdly, we need to empower our patients. They need to participate in the hypertension control and management of their situation actively. So we need to provide education and support patients for healthy lifestyles and try to help them comply to the treatment. Then to control their blood pressure steadily for a long time. And fourthly, and that's also very important to recognize and reward those contribute to hypertension control largely in globally. So we need to provide excellence awards for champions, projects, and organizations. And that is what Hypertension League do and also our partners do. We award the champions projects organizers globally and in every country. We try to encourage more people to learn from them and also to improve the hypertension control globally. So apart from the healthcare organizations, we also need to activate policymakers for promotion of health policies. Firstly, the policies that promote healthy diets, facilitate physical activity, reduce sodium intake, decrease harmful alcohol consumption, and also eliminate tobacco use and artificial trans fat. So the health policies to promote these important healthy lifestyles works more importantly and also cost effectively for global hypertension and also for other NCD control. And secondly, the policies that ensure the sale and the use of validated automated blood pressure devices to make our measurement more accurately and the diagnosis correctly for the patients. So the patients getting right treatment, that's very important too. And thirdly, we need to update the national drug formularies to ensure the availability and affordability of high-quality antihypertensive medications with emphasis on long-acting and single pill combination to improve the control rate and also improve the compliance of the patient for steady and long-term control of high blood pressure. So for the health policymakers to provide the healthy lifestyle and healthy environment and improve the compliance for the patients, we also need to activate healthcare organizations and also our societies to help to speed up and scale up of quality care for prevention and control of hypertension. So we need the regular training to make sure the quality of performance, and a certificate for healthcare professionals, and also for those who regularly assess blood pressure but non-physician, non-nurses. So they are not medical professionals, but they are helped and working on the regular assessment of blood pressure. They need regular training and try to make their performed in a high quality. So for example, PAHO with WHL and other partners, we developed the certificate training course for blood pressure measurement. It is available in PAHO and WHL website can be used by health professionals and non-professionals who are need to assess blood pressure at home or at their working site. We also need to, in our societies, to promote team-based, patient-centered care. So we need to involve the patient participant control and also provide the high quality, convenient, and inexpensive care for the patients. So we need to involve the physicians and the non-physicians and even non-nurses to join the team and to help for the, for the people, for the job not needed professionals. So we can work as a team, for example, measure blood pressure and health education. So we may not need physicians and nurses, which are very, very, limited for the countries, specifically low middle income countries and remote areas. So we need to involve more people join the healthcare team. And also we should use hypertension registries and public screening programs. We find the patient and refer them to healthcare services to get this registered patient get properly controlled and get their blood pressure controlled. So that's the global situation. But for the Africa countries, the situation even severe than the global average. So from the global burden of disease studies, we can say that in all Africa countries, high blood pressure are major risk factors for the global burden of disease. So in Central and Sub-Saharan Africa, high blood pressure is a number 4 cause for the disability just life years. For Eastern Sub-Sahara, it's a number 5th. For the North Africa and the Middle East, it's a number 1. And for the South Sub-Saharan Africa, it's a number 4. So they are all within the 10 leading causes of disability just life years. And also, sadly, we can say the risk factor related to hypertension, like high body mass index in all Africa regions, are also the leading cause of disability just life years, and also glucose. So these all the major factors for cardiovascular disease and other major NCDs are increased, although we have malnutrition and high, the sanitation. All these factors are largely improved, and the red and yellow one means increased annually for these countries. So they are hypertension-related risk factors. They are not only major risk factor for disability just life years, but also they are increased largely in whole Africa countries. So such important controllable risk factors, they are not properly controlled in Africa. Similarly, we can see for African 25 years old population, the prevalence of hypertension is about 30 to 50%. We estimate it's about, it has been estimated about 250 million of hypertensive patients in Africa. Only 27, less than a third, little bit more than fourth, quarter of them know their situation. They know they have blood pressure, and only 18% are getting treated, and very sadly, there are only less than 7% get their blood pressure controlled to the goal. So we can say for this kind of situation, there are major causes of disability and the mortality, and they are the not properly controlled, but supposed to be. And we have the plenty of strategy to control it, so we need to implement it. So for African countries, we need to urge for urgent implementation of appropriate strategy for hypertension diagnosis, control, and prevention in African countries. The first, we need to extensive implementation of heart technical package. This package has been largely implemented in South America, in Asia, and in some of the African countries. Several African countries already started to do it. This technical package includes 6 components: healthy lifestyle counseling, evidence-based treatment protocol, access to essential medicine and technology, risk-based CVD management, team-based care, and system for monitoring. So we know what we do, and we have the system to monitor the quality and the quantity of the progress. And secondly, we need to engagement to aim at health promoting environments. This is similar as our global call for the health policy. For example, salt reduction policies and sugar and alcohol taxes to reduce the salt intake and reduce the sugar and alcohol intake in African countries. Thirdly, we need to implement the cost-effective screening and simplified treatment protocol. This protocol has been demonstrated the very cost-effective and improved hypertension control largely. So for these strategies, we need availability of low-cost single pill combination. This can be improved compliance and improved control rates. And we need to provide easier access to telehealth and mobile health. This specifically for remote areas without, the easy access to health services, and specifically for the, the COVID-19 pandemic period, you can't get, together for the health services. So this is a very important, trying our best to provide this access. And also we need to implementation team-based care by healthcare workers, by quality trained and qualified, non-physician, non-nurses to join our team-based care. So this is what we mentioned, health technical package, which helps primary care services to improve management of cardiovascular disease, and also specific for risk factor hypertension and diabetes and more. So this was developed since 2016 and issued in 2017. It included health, lifestyle counseling, evidence-based protocol, access to essential medicine, technology, risk-based CVD management, and team-based care and system for monitoring. Every module have a detailed training and strategies, so you can apply it immediately. And also this year, WHO also issued a HAS for diabetes management, and also provide the implementation guide for how to imply in your own specific conditions and how to develop consensus protocols. So this not only give the the guidelines, but also give you the very detailed strategies and technical how to train it and how to implement it in your specific settings. So in last week, we launched on the World Hypertension Day, we launched a specific call to action on hypertension control for Africa. So we call for African countries to accelerate the implementation of all necessary changes in healthcare management. For example, to enhance the detection and treatment of hypertension, to provide single pill combinations, to promote home-based monitoring, and provide availability of mobile solutions, and also step-down care. For example, to including the non-physician, non-nurses to join the team for the hypertension control, and the reduction the cost of drugs to provide them more widely for more people can get available and affordable drugs for control their blood pressure. And also we promote the cheap but accurate blood pressure monitoring devices. We try to call to Africa countries and the government and the societies, try to provide availability of this important measurement and treatment. And this call to action, we try to stimulate all countries to adopt these solutions. We have these solutions and also the strategy to apply these solutions and try to achieve the 3 goals in Africa by 2030. So from now on, it's only 9 years left. We hope to achieve 80% of adults with high blood pressure in Africa can be diagnosed. This means we are going to triple our awareness in Africa with improved screening and all the measurement programs, trying to get our hypertensive patient that can be detected and diagnosed. And the improved diagnosed patient, for 80% of them can get treated, which means 64% of all hypertensive patients can be treated. So here we need, the single pill combination, need the long-term drugs, and also for the long-term prescriptions can be easily getting the drugs and also getting the prescriptions and also refilled. So all these high quality, long-acting drugs should be available to help these patients getting, treated and controlled. So, and among those treated, we hope 80% of patients, which means 51% of all hypertensive patients can achieve the goal of systolic blood pressure less than 140 and diastolic blood pressure less than 90 mmHg. So this ambitious goal will try to stimulate all our countries and societies to largely and significantly improve hypertension control in African countries. For intermediate step by 2025, that's the WHO goal for 2025. We should improve the current our awareness, treatment, and control rate doubled in Africa. That means we are going to improve awareness from 27 to 54%, for the treatment to improve from 18 to 36%, and for the control rate to improve from 7% to 14% respectively. If we can achieve that in 4 years, which has been improved, demonstrated in the areas adopted the HAS technical package, then we can improve it in Africa too if we can apply these policies, and also we can implement the HAS technical package, then we certainly can achieve this goal. But need all the parties, all the societies and the government to work together to achieve this. So the goal is ambitious, but the strategies and also all these tools are available, and all the experiences from all other countries can achieve it. If we work together, then we can also achieve in Africa. Thank you very much for your attention.